Hello, everyone. Welcome back to The Truth About Liver Cancer, a program that is produced by Blue Fairy, the Adrienne Wilson Liver Cancer Association. A nonprofit organization, Blue Fairy's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, through research, education, and advocacy. Now, you may hear us use the phrase HCC a lot today, and HCC is the abbreviation for hepatocellular carcinoma. Today's workshop focuses on meeting HCC survivors. We're going to hear 3 remarkable and quite different stories from these amazing people, but they all have one thing in common. They had liver cancer and they beat it. And there's not a lot of people that can say that. I know their stories will fill you with hope and inspire you to take action. I do want to thank our sponsor, Exelixis. Exelixis is a genomics-based drug company located in Alameda, California, and the producer of CaboMedix, a treatment approved by the FDA for advanced liver cancer. Now, before we bring our first panelist to the stage, I want to walk you through the platform. If you can hear me right now, would you let me know in the chat? I would love to hear from you. The chat is super interactive. You can chat with each other. You can use emojis, all kinds of fun stuff like that. Now, if you have a question for our panelists, and the questions will start at the top of the hour, the Q&A, please look at the very bottom of your screen where it says Ask a Question. You can see we already have questions that people asked while they were registering, which is fantastic. We will do our best to get to each question. Now, please look at the questions that are already there because you can vote them up. So that way, the people who have the most votes, the questions with the most votes, we will tackle those first, but we will do our best to get through all of them. I do want to remind you, oh, thanks. Hello, Danielle, Bill. Okay, wonderful. I do want to remind you, though, that these are survivors. They are sharing their personal stories. So I see some questions in the chat that are very specific. We will do our best to answer them. But again, please remember, these survivors are not giving medical advice. They are just sharing their personal stories. So if they answer any of your questions, they're coming from a personal experience. Just a disclaimer, I have to say. Also, I'd like you to take a look at the poll. So we do have a poll. If you go to the bottom and click the word poll, it'll pop up. And we're going to leave this poll up about 10 minutes or so. We want to know, what is your relationship today to HCC, to hepatocellular carcinoma? Are you a current patient? Are you a survivor? I know we got 3 survivors here. Are you the current caregiver of a patient? Were you the caregiver for a loved one who had HCC? Are you a medical provider who sees HCC patients? Or are you someone who feels that you might be at risk for liver cancer because of underlying liver disease, such as fatty liver, hepatitis C, or hepatitis B? Or we already have someone who voted and they are in the other category. We try to cover all the categories. We don't always get there. So that's okay if you're in the other category. So please pop that poll. Just click that word poll, pop that up, and answer our poll so we can find out more about you as an audience. That really helps us shape future programs. All right, let's get started. We are going to bring our very, very first panelist to the stage. And let me get her, and then I will introduce her. While she's joining us, Dani Duran, a 20-year cancer survivor and advocate, is dedicated to transforming organizations and individuals by harnessing the power of storytelling, fostering open communication, and promoting empathy and inclusion. Born in Brazil, she is a marketing executive who has worked globally in mission-driven organizations for the last 20 years. Residing in Maryland with her husband and 2 children, Dani published her debut book, Viva para Cantar, apologies for the accent, in 2020. And that book became the first Portuguese language, she was the first Portuguese language author to delve into the topic of fibrolamellar HCC and survivorship. Dani, thank you so much for joining us.
Thank you. Thank you for having me. Can you hear me okay?
Yes, you sound great. And just a little note to Michelle, let us know if we are streaming on Facebook. We think we are. So, can you take us back to the beginning? What was the timeline and what symptoms were you having? What was going on?
Let me take you back to about 2000, late 2000, 2001. I was feeling tired, but I have low blood pressure. I've always had it all my life. So that didn't, alert me for anything. I was actually interested in doing a static procedure. I wanted to do liposuction. I was 26, 27, and I wanted to do liposuction because I didn't like my hips and all that. So I went home to Brazil, of course, the land of cosmetic surgery. And so I met
I'm
with
not
the
sure
doctor.
everyone knows that, by the way.
Yeah. So, I met with the doctor and he was like, yeah, sure. It seemed like you're a good candidate. You're healthy, you're young. So here's the, list for your pre-op. So go back to the US. I was living in New York at the time.
Okay.
I had gone to grad school there, was working there. And he was like, when you're getting ready to come back here about a month or two before you return, get those tests done and bring them to me and, give me a call, we'll schedule it. So I didn't think much of it. Did exactly what he told me. And then a month or two before I was supposed to go home again, I got the tests. And my physician in New York called me and said, well, you have severe anemia and that needs to be investigated. Don't get too concerned. You're female, your age group, it's probably related to your menstrual cycle, but we got to, look into that. And by the way, there's no surgery for you until we sort this out. So I was, a bit disappointed, but nothing, I wasn't too worried about it. So I ended up returning to Brazil in the next few months and I actually stayed there. I got another job and I went back home and, still that thing in my head, I went back and they couldn't find anything wrong with me. I mean, I went to a hematologist. I kept going and, I had a dental procedure and I bled too much. And so the dentist was like, you got to investigate that. There's something going on there. It might be something with vitamin K. So I kept digging. And then I went to see an acupuncturist. I went to see all these medical professionals. Eventually I went back. Somebody asked, ordered a bunch of tests. Vials and vials and vials of blood work. Okay. So I came back, I got the results back. And in Brazil, way back when, I think about it, 20 years ago, how you got your test, your blood work now and you can see the ranges?
Yeah.
Some of my stuff was crazy. You're supposed to have 50. I had like in the thousands. And it was, my liver markers and my white blood cell was down. And I was like, okay, I got to go back to a doctor. So I went back to the hematologist and she was at a loss. They were thinking it might have been lupus because I had, one of the markers. But she said, well, I'm going to try my last thing. Let's do an ultrasound. Okay. Of your abdomen, see if there's anything else going on there. And you have to go to this doctor and she's the top one in the city and she's really good. And luckily, she was a good friend of my family. So I got in right away. Nice. And this woman had seen me grow up and we were in this dark room and I never forget that day. We were just chatting about whatever. And all of a sudden she stops and just like she knew me, I knew her and she was speechless. And I said, what do you see? And she's like, I see something. I see a lesion and it's pretty big. And she's like, your gallbladder's over here. It's not supposed to be over here. So obviously I saw she was concerned and she was like, okay, we'll wrap this up. You need to go get an MRI right now. I'll walk you over to the other side of the hospital. Wow. And I said, what about a biopsy? She's like, there's no biopsy. This is big. It needs to come out. So, we're going to have to do things a little bit different here. And of course, I did the ultrasound. And at that point, they thought I had a tumor that wasn't malignant. It was benign.
Okay. And how big was the tumor?
It was over, I actually ended up having two. The one that they saw was over 18 centimeters. So it was like this size, the size of a melon. It was huge. And that's why all my organs were shifted.
Yeah, I would think so.
And it was a miracle that I had another one, a smaller one. It was about 3 centimeters, but it's a miracle that didn't spread beyond the liver.
Yeah.
And that my liver didn't rupture or anything, because,
Right.
you know, when we saw, she saw the test, she was like, you got to see a surgeon right away. This needs to come out. And I ended up, you know, meeting with a few physicians, a few surgeons. And the one that I ended up going with said, you know, you're under my care now. I need to schedule your surgery. Go home. I need to make a few calls. This is a Friday, right?
Right.
Your surgery is on Tuesday or Thursday. I just need to see, you know, the availability, but this needs to happen as soon as
Okay.
possible.
And how much of your liver was removed?
About 65 to 70% the first time around.
Wow. And you know what I find really fascinating, knowing your story, is when did you get the official diagnosis of what you had?
So, you know, looking at the, and you know, this is back in 2002, right? So if so I have to say I have a very rare type of liver cancer. It's called fibrolamellar, and it's mostly seen in young adults and children, and in healthy livers. So I had no underlying conditions. I had no hepatitis. I had nothing. So when they first saw it, they thought it might have been an adenoma, and then there was another type of a benign tumor that they thought I had. They weren't even thinking about it, right?
Right.
So when I had the surgery, they did, you know, the freeze biopsy, right? Because my surgery was 11 hours, I believe.
Wow.
The first one, and it was going okay until I flatlined 3 times, and yes, and that was not great. And obviously my doctor and I developed this relationship that's beyond patient and physician, because just, you know, talking to him, he said, you didn't want to go. Every time I felt you there, you're fighting. So,
but did the doctor tell you that you had cancer? Did he say those words to you?
No. So I had 2 doctors. I had the surgeon and I had the hepatologist, and they worked together. And so when they did the freeze biopsy, and in, you know, in the OR, it didn't look malignant. They was like, oh, okay, great. She's awesome. You know, she just needs to survive this. So of course they sent it to the, you know, to get it, you know,
fully tested,
really biopsy. And it took about 2 weeks. And then I was, you know, I had spent a lot of time at the SU. I had gone home for about 3 days. I had complications. I had fluid in my lungs. And then I went back to the hospital. And then shortly after that, they finally got the results. And yes, they were wrong. It wasn't, you know, a benign tumor. It wasn't, you know, liver cancer. And it was this very rare type that, you know, they had never seen before. They heard about it. And so they knew how much I was struggling. I was, you know, I had a lot of procedures as a result of that surgery, because, you know, I had a lot of complications, and I just wanted to get out of the hospital. And it was this feeling that I had that no matter how much I tried, I couldn't get out. And then, you know, when the doctor came with this news, he came into the room and he saw I was finally happy and I was interacting with my friends and all that. And he's like, I can't tell her.
So who in your family actually told you? Because I know someone did.
Yes. So so they agreed. So he told my parents, and my parents said, please don't tell her. Let's get her out of the hospital, and we'll go back to not the surgeon's office, to the clinician's office. And, you know, and then we'll tell her that she has to do some sort of treatment, all that. So I went back, and I, you know, you don't know, I went in there and I was like, oh my God, the worst is over. This thing is cancer. I'm good. And, you know, now looking back, my vibe wasn't everybody else's vibe, for obvious reasons. So I get
because
in there,
they knew, and you didn't.
They knew. Everybody knew. My sister knew. My brother knew. My parents knew. I don't know who else knew, but my entire immediate family did. And so I went back to the doctor, and he was saying, oh, you know, remember we were talking about like the biopsy. And so we actually found some like not so great cells in there, you know.
Not so great.
He never said cancer, you know, bad cells, whatever he said. And then, you know, like we have to be really careful about that. You need, you know, we're going to do a little treatment. And I end up having TACE, you know, the chemoembolization, and you have to go to the hospital. We're going to do it once or twice, but you'd be okay and all that. And I was kind of like shocked, but I was like, okay, that sounds good. Okay, fine.
But still no C word.
No, that was never uttered. So I get home kind of like, well, it's not so great that I have to go back to the hospital. And it seems like, you know, a pretty invasive procedure, but, you know, I've been through hell and back. I can do this. And so I'm sitting there. My sister's like, how'd it go? How'd it go? She hadn't come with us. And I said, well, you know, the kind of bad news is that I have to go back to the hospital. I have to do this treatment. The good news is that I don't have cancer, and this treatment, you know, it's not chemotherapy. I don't have to do chemotherapy, I think I said. And she burst out. She was like, what? Yes, you do have cancer. And the treatment that you're doing is chemotherapy. What part of that did you not understand? And so that.
How did you feel when she said that?
Blindsided, betrayed. And of course, my parents wanted to kill her. You know, why did you do that? And she kind of wanted to take her words back. But at the same time, she felt that I needed to know.
Yeah, of course.
You know, and again, that's kind of typical of her. The delivery is not kind of, you know, polished. She's gotten a lot better. But the intention, you know, is there, and it's always to do the right thing.
Yeah.
So
you know, pause you for a minute. Just want to remind people. So again, Danielle had fibrolamellar HCC. So it is a type of HCC, but like she said, it's very, very rare. It does not have underlying liver disease. It occurs in healthy livers, and it typically happens in older teens or very young adults. So again, incredibly rare, and usually, but not always, more responsive to treatment. So you did the chemo embolization. Are you able to put it behind you and just move on with your life?
No, what we didn't know is that back then is that chemoembolization is really not effective for this type of cancer, the one that I had.
Right.
Now, you know, because it's very rare, like you said, Andrea, is 1 in 5 million. We have a feeling that there might be some cases that are underdiagnosed, but it's indeed very rare. So I thought I could, because they took a bunch of my liver out, but I had always known that they had no margins, right? The tumor was so huge. If they cut more, I would have died. And
would you explain a little more, just for people in layman's terms, what you mean by margins?
Yes. So my tumor was very large, right? It was 18 centimeters, and I had another one. So ideally, when the surgeon goes in, you know, in addition to removing the tumor, they remove the area around it for safety reasons, right? Yep. So ideally, that's what happens. And when the surgeon says, oh, we had plenty of margins, you're good, right? Because they cut it all around it.
Yeah.
So for safety. And so I didn't have that luxury because they had already taken almost 70% of my liver. The surgeon's idea was, if she's alive, we can go back in. You know, if we can't take any more, it's too risky. So from the get-go, he said, I have to go back in. And so at that time, we were doing ultrasound only, and the radiologist and everybody was like, no, this looks clear. This is scar tissue. And so we discussed that right after. He was like, no, you know, I'll give you 6 months and we'll do another surgery. But as the time went by, they were like, no, look, nothing changes. It's scar tissue. So for 5 years, so I would start going 3 months, and then 4 months, and then 6 months. And then for 5 years, nothing changed. I ended up getting married, moving back to the US, and everybody's like, oh, you know, this is, you know,
it's behind you, right? You
thought, go live happily ever after. This is done.
But you are getting regular scans of your liver.
Yes. Yes. And you know, nothing had changed. Everything looked great. So the last scan I had was in February 2007, right before I got married. I got married in March. So I moved here and everything was fine. And I had known that we didn't want children for the first year. So that was fine. But then I started having some allergy things and whatever. And my husband was like, you know, don't you think it's a good idea when we go to Brazil for Christmas that you'd see your doctor and do another scan? And I say, yeah, no, that can't hurt. But, you know, like, because that was part of my routine, I had scheduled lunch with former coworkers. I was like, yeah, I'll go do this. And then we go get lunch, because that's what I did, right? I used to do those, you know, exams, you know, the ultrasounds, whatever. And then I'll go back to work because it was, you know, so that wasn't the case. So in December 2007, I'm talking to the same doctor. And this time she's telling me, you know, all about my wedding, how much fun she had. And I'm thanking her for the gift. And all of a sudden she stops. And I'm just like, oh, please. I
Oh.
know that look. And she
Mm.
said, I am so, so sorry, but there's something in there.
Oh,
And it's just, I think I told you, right? It's just like in the movies that you see. Um, the word like wah wah you don't hear anymore, it's just
yeah,
like it's an out-of-body experience. I'm pretty sure if anybody here has been through it or with somebody that they love, that's why they say, kind of like when you deliver news like that to someone, just give them time, because if you explain, they can't hear it.
that's
I
right.
certainly couldn't.
Yeah.
um and then we did it all over again, but the good news is the tumor was much smaller. It was the size of an orange. It was 5, 6 centimeters. And again, it was like you got to do all these tests. I mean, the image is so beautiful. I still have it. It's so colorful. I remember it was so clear that you could see. And the doctor's like, you see, I can do this, you'll be fine. And it's
So were
awful
they
that's happened.
confident this time, the second surgery, they could get those
Absolutely.
margins? Yeah. Okay.
Absolutely. So
Okay.
that
And
kind of
where did you
changed.
have that surgery done?
So the same team back home in Brazil, and
Yeah.
that time my husband was with me, and obviously
Aw.
being American, he was like, "Oh, we got to go back to the U.S. We have more resources there and all that." And I'm like, oh, "I don't think so." And then it wasn't until he reached out to somebody, but I can't understand, right? That's all he knows.
Right.
He reached out to someone that he trusted, a friend's dad that he grew up with, and a very well-known surgeon, that gastric surgeon. And he said, does she have health insurance? Does she have good access to good health care there? She should stay. The
Okay.
doctors that operate on her know her better than anybody else.
Yeah.
She should be where she is. And he kind of like, okay, I understand that now. And it was the best
Okay.
thing we could have done, because they knew it. And so the surgeon was like, I'm not surprised. I was waiting for the other shoe to drop. But
Right.
and now all my surveillance was done with ultrasound. Now we don't do that. Now we know better, right? Now it's MRIs and CT scans, and I alternate these two because I was 28 when I first had fibro.
Right.
I'm gonna have to do once a year for the rest of my life. So the radiation, when you do a one-off, not a problem.
Right. Yeah.
But if
But
you're
it's
like
ongoing.
me, hopefully I'll be going for many, many, many years. That's my personal. And when I speak to the doctors, they're like, yeah, we hear you and can certainly accommodate you. So you do MRIs for a few years, and then we go back to CT scans, and
Got it.
that's how we do it.
So one last question, Dani, before we put you back in the audience and bring you up again later. What's one thing you wish you had known at the beginning of your diagnosis, that first time?
That I was going to make it, of course. But I think, what you're doing here, Andrew, is very important. I felt very alone. Of course, in 2002, you had the internet, but I think there was a combination of the stigma, right? Because people like, don't tell anybody you have this thing. And I'm like,
And then
I
they didn't even
can't.
tell you. I mean,
Yep. Yeah.
yeah.
And don't tell, because people are going to start counting you out, and people are going to say inappropriate things. And they did.
And they
And
do.
they did. But I was ready. Like, oh yeah, I know somebody had liver cancer. Oh, they died. Or what are you doing drinking Diet Coke? Are you killing yourself?
Oh,
And
God.
and everybody's in your business. So you have to be prepared for that. But I wish I had events like this. I wish I had organizations like Blue Fairy that I could go and hear from other people to say, their resources, or, have you looked at this, and find a second opinion. And I think it's very important for patients to have a voice in their care. And I had to develop that. I didn't know that until I really had to go to Hopkins and be accepted and translate my biopsy and fight with some heartless nurse that, was at the time helping my physician, who next time I went there, she was gone. So the muscle that I had to build. So I think education, what you're doing here, and community, these are two things. They're very important. And I wish I had that back in 2002.
Well, on that note, I put in the call to action. There's a green button, everyone. It says join Blue Fairy's liver cancer community. So we do have a community. It is private. It's actually HIPAA compliant, so it's not a Facebook group. And so we encourage you to join that community. We're going to leave that button there. If you have any questions for Dani, please put them in the ask a question, because she will be back at the top of the hour. Dani, thank you so much.
Thank you. Thank you, Andrea. Thanks, everybody.
All right. Up next is Bill Remak. We're going to invite him to the stage. Bill Remak is from Petaluma, California. He is a cancer survivor and a two-time organ transplant survivor. As a national and global patient advocate for chronic diseases and medical research, he strives to collaborate with experts, activists, and many stakeholders to drive policy reform that improves healthcare access, delivery, and systems that push the boundaries of science and technology to achieve the best value and quality outcomes for healthcare consumers. Bill, thank you so much.
Thank you.
You sound and look great. Now, I want everyone, Bill has a very complex story. So one of the things, Bill, I'm going to kind of ask you throughout is sort of what age you were to kind of help people. So we're going to go back to the beginning.
Okay.
How old were you when your whole experience started? I know you were quite young. And how did
Right.
you, what symptoms did you have? So let's start with how old you were and what symptoms.
Okay. So I'm 70 now. I was 13. Okay. So, and at 13, I collapsed. I was taken by ambulance to the hospital, and a number of tests were done on me, and they said I had chronic persistent hepatitis. And I had a fever. I was quite ill and somewhat jaundiced as well.
Wow.
And very lethargic. Had some slight difficulty breathing and so forth. And I was in the hospital for a couple of weeks, and they had a plastic tent over me. They had signs on the door. Nobody could
Because they didn't
come
know,
into
right? Did
the
they think it was
room.
contagious? They didn't know,
They
right?
didn't. Well, they didn't know, but when they did find out it was hepatitis, they had a quarantine protocol at that time. So anyone coming
Wow.
into the actual hospital room, there were yellow signs on the door, and they were fully suited up in PPE, completely masks and shields and gloves and hairnets.
This is
And
about the late 60s, right? To give people a reference.
that's correct.
About the late
That's right.
60s.
That's
Yeah.
right.
And I just want to let people know that
And
hepatitis C and B, that's not the case anymore. So, so what
yeah,
did the doctor say
they didn't
about
have
it?
a name for it.
Yeah. And what did the doctor say about it?
So they called it non-A, non-B, and later on, but they said that they didn't know at that time what would happen. They said it could become dormant, but to keep them informed, they said I had an acute hepatitis at that time, so it was something I had to be hospitalized for to stabilize and then be
Did it go
treated
away
until
on
it
its
subsided.
own?
But yeah, and it did kind
Okay.
of go away or become dormant or
Dormant.
whatever.
So how old were
And
you when the symptoms came back? Any symptoms?
so it was about 4 or 5 years later, I started feeling some soreness in my lower right abdomen.
Okay.
Just slightly below my lowest rib on the right side, and I
And
could
for people
feel
who
it when
don't
I
know,
pressed.
that's where our liver is.
Yeah, that's where the liver is. So if you put your fingers there and you
It's right
press,
there.
and you feel some soreness, and so I kept seeing my doctor, who referred me to a hepatologist. And in 1972, I started getting liver biopsies. A liver biopsy
Wow.
at that time was done with a very long needle like this that Um, they put right into
The
your
liver.
liver, and they took out a worm-sized piece of your liver to
Oof.
examine under a microscope. I probably have had uh, in those years until uh, until the great event that dealt with the liver disease, um, perhaps 30 or 40 of these procedures.
So what did the
So
biopsy show?
yeah,
What did that first biopsy show?
so it showed that I was developing cirrhosis
Wow.
already in my teens, developing cirrhosis in my teens. I was not, really wasn't a drinker, and I wasn't. Uh, I don't think my diet at that time was anything uh, very outrageous. Occasionally, I had fast food, but generally that wasn't uh, what I ate, and
So what did the
otherwise
yeah,
I was
so
quite healthy.
what did the doctors tell you to do? I mean, you knew from as a kid you had this non-hip A B because like you said, they didn't have a name for it yet.
Mm,
What did the doctors
right.
suggest that you do about the pain and about just what they were seeing in the biopsy?
So the pain went away, but they
Okay.
wanted me to come every 6 months for a checkup. And sometimes, and they would certainly order blood tests, and sometimes they'd order a biopsy. So I believe I was getting a biopsy about once a year
Okay, so
at
there
that
was
point
ongoing surveillance.
throughout my young adult, yeah, throughout my young adult life. By the time I was in my early 40s, I was starting to have some my mid 30s to early 40s. I was starting to have some discomfort. I was
Okay.
starting to
Mm,
get tired a lot. I was starting to feel bloated, and at times I was starting to feel somewhat confused,
mm,
which
that's
is called
scary.
encephalopathy.
Yeah.
And so by that time, in the kind of mid to late 80s, they the doctors called it uh, hepatitis C. They had given it a name,
Finally.
hepatitis C.
And it was such a
Finally,
logical
right,
name. I mean, just
right,
AB, now we have C.
yeah,
Okay. And so in addition to your exhaustion, and the pain, were your liver enzymes elevated? What other symptoms did you have?
yeah. I had a very very low platelet count.
Okay.
I was anemic.
Wow.
Uh, I was becoming somewhat of a fall risk because I had a difficulty sometimes with my balance, but
Wow.
because I felt weak. I felt weak quite often, and especially in the afternoons. I found I had more energy in the mornings, but I found that I really was having difficulty working, and and the job that I was doing required me to be on my feet, to have a lot of concentration, and so forth. I also found that I was having difficulty also with digestion, and sometimes difficulty keeping my food down. And uh, I went to the doctor, and I was given some medication to help me with indigestion.
At,
And
at,
at that point,
at
yeah,
what point, I'm sorry, I'm going to jump ahead because we have so much to cover. Your story is
sure,
so fascinating.
right.
So they're treating these symptoms, right? Not solving the problem, but they're treating the symptoms. At what point was the
Hmm.
decision made that you're, you were not going to survive with the liver you were born with, let's say?
Okay, so this was about 1994.
Okay.
1994, uh, my physician told me that I needed some more tests. And they also found that I was actually becoming quite ill with a gallbladder
Mm,
infection. And so in the very beginning of 1995, my gallbladder was removed. And in that January, at the same time, they did a biopsy.
okay.
But they also had a chance to actually, because they did had a camera inside me, they were able to see the liver. They
Okay.
indicated to me that the cirrhosis was so serious that I needed to get a liver transplant very soon. And
Wow.
that was in 1995. That was 1995.
At what point
So
did they
they,
tell you that
they
that
referred me to the list.
they did?
Yeah.
Okay. So and
Yeah.
how
They
long were
referred
you
me. Yeah.
how long were you on the list?
So I had that referral in the late spring of 95. And by within 2 years, I was firmly listed
Okay.
for a liver transplant.
And at what
I
point
had
were you
gone through all the evaluations and so forth.
at what point were you told that you had HCC? That in addition to your liver's failing, guess what? There's also cancer in the
Okay.
liver.
So it really didn't happen that way. The way it happened was as I was waiting for a liver transplant, I got very, very ill.
Mm,
I had I was going into end stage liver failure. Um, I was having to frequently have the fluids drained off me because the medications I was taking was not taking off enough fluid.
right.
And that pressure was pushing on my lungs and my heart. I was also at times not able to keep food down. Uh, I was having bleeding varices, meaning that I would suddenly start vomiting, and what was coming out was blood,
Okay.
lots of it.
Yep.
And it was it was very difficult time. So they hospitalized me,
Okay.
and that was in December of '97, at the very beginning of the month, 1st or 2nd of December. And after 2 weeks, they were doing further tests on me.
Okay.
They did, they had found something on an MRI, and they had done some further tests, and they told me they found several tumors in my liver.
Wow. And I just
So then
I just want to let
they
people
said was
know,
cancer.
yeah, I want to let people know that not every person who has cirrhosis develops liver cancer. Not every person who's had hepatitis C develops liver cancer, but it definitely puts you at
That's
a
true.
much, much higher risk. And so I just want to put that little disclaimer there. So when did you get the liver transplant, which is really the best way to cure HCC is a transplant
Right.
or resection, i.e. surgery. When did you get it and how did you feel afterwards?
So I got it in on January 5th of 1998. So we are talking 25 years, 7 months, and 10 days ago. Okay.
Wow, I love that you know that. Oh my
Right.
God. And how did you feel after your transplant?
I was ready to leave in 5 days, but they said I had a very slight fever and they wanted to keep me 2 more days. So I left after 1 week. I walked on my own 2 legs
That's
out of the
amazing.
hospital. They took me down to the lobby in a wheelchair, but from there I walked to the console.
Um, okay, and so again, I want to kind of help people understand. So you have a liver transplant, and that is curative for HCC, for primary liver cancer. But,
Correct.
and I don't think a lot of
Right.
people understand this, is that a transplant doesn't guarantee that hepatitis C is cured. So what was the plan
Right.
with hepatitis C for you at that time? You survived cancer, but you still
Okay.
have this underlying liver disease.
So to answer that question, let me back up a little bit with regard to the procedure, how it was different from a normal liver transplant.
Okay.
So having a liver transplant and liver cancer, they had to separate the process into two procedures. The
Oh,
first procedure
fascinating.
was with the first procedure was with a radiology team in one OR, where not only were they taking pictures all the time, and able to see the liver, but they were injecting it with a chemotherapy solution to kill the tumor.
Nice.
And that procedure was called chemoembolization.
Yes.
Right after that procedure, within 10 minutes of coming out of that room, wheeled into another OR very close by, they then had me fully prepped for a full liver transplant.
Got it. Okay. So after the transplant, and I'm just going to jump ahead a little bit because I have so many more
Sure.
questions and I don't want to run out of time. So after the transplant, I mean, you walk out of the hospital, you feel great. What were they going to do to treat the hepatitis C?
So, as you alluded to, the transplant doesn't cure hepatitis, so they were going to put me on interferon and ribavirin, which did not happen until 13 months after the liver transplant, because they wanted to give the
Yeah.
transplant time to actually heal,
Yeah.
the surgery to heal. And
for people who
from that
don't,
point,
and for people who don't know, again, just want to help people
yeah,
understand who are new to this. Interferon was I believe the first and certainly one of the most common treatments for hepatitis C for years, but the side effects are really, really devastating. So I can understand why they wanted to wait to make sure you were completely stable after the
true,
transplant before. How many years were you on interferon?
8 years,
Wow, that's
8
that's
years.
incredible. That is really, because I've seen what it can do to people. It's so incredible. And um, I know that that did not cure everything. And what happened to lead to the second? Yes, Bill's had not one, but two. What happened to lead to the second liver transplant?
So going on interferon in 1999, in the spring, after all those years, by 2006, they saw I was going into liver failure very quickly, and was hospitalized in my local community and transferred then into the medical center for an emergency transplant. And
Wow.
that was uh, actually in April of 2007. And
How was the second
then
transplant
by
different than the first one? Because I know they were pretty different.
yeah, I flatlined a couple of times during that surgery, and it took me a long, long time to recover. I was in recovery at the medical center for about 3 weeks.
Wow.
I was in a coma for several weeks and had 2 or 3 procedures for infection and hemorrhaging and so forth. And then I was released to a rehab hospital where I was there for a number of months. And by the fall of that year, I went home to relatives to stay who cared for me while I recovered and actually had to learn to walk again because I had been
Oh my
hospitalized
God.
for so long that I had rather severe atrophy.
Wow. Oh my gosh. I am so glad you made it. And I've had the good fortune of meeting you in person several times. I'm so
Thank you.
relieved. Um, when did you finally get to take the drugs that cured hepatitis C?
In 2016, and
Oh,
by
goodness.
by by started by in the spring, and the summer by the summer of 2016, my physician told me that I was now cleared of the virus and
Oh,
cured. And again, I was elated. It had been a journey that had taken over 50 years at that
wow.
point.
Wow. Oh my gosh. Oh, wow. Um, what was what was that like for your family, especially the family you had that was with you, as a teenager, like siblings, and what was that like for them?
Um, I think it was hard for everyone to kind of wrap their head
Yeah.
around it, especially me. But to have this kind of this third or fourth chance, I guess, at that point, to you know to move on and the wonderful things that have been able to occur in my life since
Yeah.
then, walking my daughters down the aisle and so forth.
Oh,
Grandchildren, and it's
oh,
I I I don't really have words for it, but I can say that the scientists, the researchers, my medical team, everyone that has been involved in this wonderful science, transplant technology, fighting and addressing liver cancer, um, hepatology, gastroenterology, and the amazing concept of coordinated care and so forth. This team effort, and we're seeing it now spread not just nationally but
yeah,
worldwide. This way of thinking, it's allowed me also to continue uh, my advocacy
yeah.
for liver disease and cancer,
Well,
and
Bill,
it's
I'm sorry
not
to
just
interrupt.
close to me, but my whole family. Yeah,
Yeah,
yeah.
so
But
Bill's gonna
it's
stick
something
around.
very,
If you have any questions
yeah.
for Bill, please put them in the ask a question, but Bill will be here to answer questions just after the top of the hour. Bill, don't go anywhere.
Okay.
I'm gonna put you back in the audience, but
Thank you.
stay tuned.
All right.
All right, we are going to bring Kay Anderson to the stage. And let me tell you about Kay. Before I do that, just a reminder, if you could click that poll button at the bottom of your screen where it says polls and answer the polls, that would be fantastic. Let me tell you about Kay. Kay Anderson has been a registered nurse for over 40 years and has practiced nursing in the civilian sector, the Veterans Health System, and as a United States Air Force officer. Kay was a guest speaker for the Maui Cancer Resources, that's MCR, in 2018 before joining as a volunteer the following year. Kay's desire to volunteer for MCR is driven by a passion to give back to Maui's Ohana because she feels blessed to have survived two cancers, breast cancer in 2007 and stage 4 HCC in 2008. She joined their board of directors as treasurer in 2020. She currently volunteers in a role similar to a nurse navigator for any cancer patient who needs support and assistance going through their cancer journey. Kay, thank you so much for joining us.
Thank you, Andrea.
And
I also want to thank you and your foundation for everything you've done in the advancement of liver cancer. I really appreciate it.
Thank you so
very
much. Thank you. And I just want to shout out, it was in your bio, but Kay joined us very early this morning from Hawaii. We don't feel sorry for her because she lives in Hawaii, but she did join us super duper early. So, so Kay, talk to us. Did you have any signs or symptoms before getting diagnosed with HCC?
I had just begun recovery of breast cancer, and I had pain in my right upper abdomen, but I thought it was rib pain because of breast cancer. I thought possibly I had metastasis to the ribs, and they ended up doing a bone scan, and when they did that, they found 3 tumors in my liver. And of course, the breast oncology said no, it's not hepatoma, it's hemangioma. And the liver community said, no, it's a hepatoma, it's not hemangioma. So we had a battle at the hospital there. So that went on for a little while until we did the biopsies. And
the biopsy showed that it was HCC.
Yeah, well, differentiated hepatocellular carcinoma. And then the camp that still didn't agree said, we've got to send it off to three hospitals from NCCN, National Comprehensive Cancer Network, which we can talk about a little later, and have make sure that they test it and see that it is HCC. And of course, it came back HCC. And
did you have any underlying liver disease?
No, I did not. As soon as it was confirmed diagnosed as HCC, my breast oncologist immediately removed me from tamoxifen and put me on Arimidex. And originally they thought that I was in a 10% category of patients, typically in the Asian community, that had no liver disease involvement that drives HCC. Yeah. But in reality, I'm one of the rare patients that are out there that takes tamoxifen, and that tamoxifen does impact the liver enough to cause you to have HCC. Now, I want to preface this by saying to anyone out there that has breast cancer and needs to go on tamoxifen, it is an excellent drug, therapeutic drug for long-term prevention of cancer, and this is extremely rare. So
yeah, it is rare.
Don't go out there and say, no, I've got to go off tamoxifen. Don't do that. I mean, it's not something that happens often. Yeah. And there's only been a handful of studies, and it's not very many people that get it from this drug.
Yeah, and if you want more information, Michelle will put in the chat a link to one of those studies. But Kay, I really appreciate you prefacing that and helping people understand it is very rare.
Yeah, rare.
So what treatment did you get for that, get at that time? What was the plan?
Well, I asked for a second opinion, and I went to Houston, where the HCC specialist in the whole U.S. was at the time. This was 15 years ago. And that was interesting in and of itself because of the process that you have to go through to get into these went to MD Anderson and to get into these facilities. And I'm sure that's pretty similar to what it is today. You have to repeat all your tests and all your medical records. And it's pretty much like an interview process, and it takes some time. And of course, anyone that's a new cancer survivor out there today, I know, because I've been through 2 cancers, what it feels like. There's an internal clock in your body that's going tick tock, tick tock, tick tock. Don't they understand? Time's running out. Hurry up.
Yeah, of course.
And, so I was stressing out, wanting to get things to go faster, and they go at their own pace. Finally, I got the second opinion, and I was told yet again that I had less than 6 months to live and to get my affairs in order, that there's nothing that they can do. Now, you have to remember, 15 years ago, there wasn't any, as you said, pharma Pharma didn't even really start working on medications to treat HCC until, as you said, 8 years ago. And really only the cure for HCC was transplant or resection. My cancer was multifocal.
Yeah.
So it was 11 tumors across both lobes. So it was unresectable. So I couldn't have surgery. And the reason I could not be put on the transplant list was because I had a previous cancer. Yeah. And the anti-rejection drugs would eliminate me from that possibility because they said that those drugs could possibly cause my breast cancer to return.
Yeah.
So
I just want to quickly recap something you said. I thought was really important. You said that the only cure for HCC at that time was transplant, which is what Bill had, and resection, which is surgery, which is what Dani had.
Right.
And Kay is right. There weren't even drugs to help extend life for advanced HCC yet. That they just did not exist. So what did they do? And I know you really led the charge on this, so tell us.
I did. When I came back to Baylor University Medical Center, which is an excellent facility, and I met with my liver surgeon, and he actually told me the results of the tumor board meeting, and they had decided to wait and watch. I said, well, I'm not going to let you sit there and watch me die.
I had to mute myself. I just wanted to join your humor.
Yeah, I said, you're going to give me all the chemo you can. And he goes, that hasn't been a proven therapeutic, there's no medical efficacy for chemo at this moment. I said, well, what do I have to lose? You've already told me I'm going to be dead in 6 months.
You're right.
I want it. So that was on a Friday, and he went across the hall, and I could hear him talk to my oncologist, and he goes, oh, Kay is not happy with our treatment plan. And that is really key for those of you that are new cancer survivors today. At that moment in time, actually it was halfway from my drive from Houston back home to Dallas. I stopped crying, put on my big boy pants, and I said, okay, no more crying. I'm going to beat this cancer. So when I met with my doctors, I took charge of my health. I started becoming my own self-advocate. And I said, I have to become involved in this team. Yep, and I have to be working with my physicians and anyone else that's going to be working with me. And I'm not just going to sit back and let it happen to me like I did with my breast cancer. I'm going to be involved every step of the way, and I'm going to be part of it. And that was the first day that I did. And I do it now. And I... Mm-hmm.
So I just want to go back so people know. So how many different kinds of chemo did you have, and how long did you endure that treatment?
Well, they admitted me the following Monday, and I thought I was going to go in like the breast cancer chemo. I would get a port, and I'd go in for about an hour, but it was totally different. I went in for a week, and it was designed to be for 6 months, 1 week over 6 months, and I was admitted to the hospital. I was taken down to interventional radiology. The interventional radiologist inserted a catheter under fluoroscopy. That's a radiology machine. It looks like a C, so they can actually image over the femoral artery. And they introduce some contrast and insert a catheter, and it goes from the from the femoral artery right into your hepatic artery, right into the liver. And then they actually put stents on some ancillary vessels so that they want to keep the blood from going out to the rest of your body. Didn't really work that well, but they want to primarily keep the chemo in the liver. And they told me it was called directed delivery chemotherapy at the time because this was new. So, and I received 4 different types of very strong chemotherapy drugs, round the clock, 24 hours a day for 6 or 7 days. I can't remember if it was 6 or 7 days. And then I was discharged.
And what kind of
lasted
side effects?
6 months. Well, there is nausea and vomiting, which they controlled very effectively with medication. They would give me in the hospital Ativan and Zofran. And because I had a catheter that was sewn into my femoral artery, I was not allowed to move. I was flat in the bed. I could only move my arms and my head, and you couldn't move any part of the rest of your body, because I did not want that catheter to move out of the position of where it's located in the liver.
Right. That
was a little hard. And by the end of 6 months, I felt like I was hallucinating and picking bugs out of the air. But after 3 months, my doctor came in shocked that it seems to be working. Half the tumors are gone. We're going to go on for another 6 months.
Wow. So when you say you did this a week at a time, that's the protocol. Were you going in like every once a month for a week at a time?
Yes.
Okay.
Yeah, and it was spread out. Let's say it was the first week of every month. I'm not sure it was the first week, but then I'd go in the first week the next month, and the first week the following month,
so
first week the following
3 weeks
month.
to recover, and then go back in, and the tumors are shrinking. But I know you had some pretty extreme side effects.
I did. I had some kidney failure issues while I lived in ICU probably a lot of the times, because it impacted my sympathetic nervous system. And so I have some very low blood pressure. I take medication just to keep a very, very, what people think is a very low blood pressure normally, to me is a normal blood pressure. So my blood pressure is very hard to control. And I had several times I went into kidney failure during my treatments, and my kidneys don't function as well as they should today. So those are probably the two biggest side effects that I have. And, I quite honestly, I manage them medically, and I'm very happy to do that, because I get up and I get to enjoy life, and I get to work with other cancer survivors today and share tips. And I'm a nurse, so I can, work with them. And I do actually work with them side by side through their journey in any way I can. Some actually have me work very closely all the way through. And some just want me in certain other capacities. There's a huge shortage of physicians. I call it a healthcare crisis today.
Yeah.
Huge shortage of physicians today in the United States. In Maui, we are short 30% physicians, and 25% that are actually practicing today are in retirement age. And they are staying because the patients are begging them to stay.
Yeah.
I believe it's also the same on the mainland too. Things are occurring. 140,000 college graduates are not entering medical school within the next 10 years. That is really going to impact healthcare across the board.
Kay, I want to turn it back to you for a second.
Okay.
Before we open up for Q&A, we stand by, everyone. We are going to do the Q&A. What updates do you have today about your liver?
Well, I just want to point out that once you are diagnosed with liver cancer, you're typically followed every 3 months for quite a long time, depending on what your doctor prescribes, and then 6 months, and then a year. And I had been followed on a yearly basis for a long time. And then about 9 months ago, they found 3 new tumors, or masses, spots, whatever you want to call them. And then I went back to 3 months, and then I was sent to Oahu. I live on Maui, to see a liver specialist. And now, with consultation with an interventional radiologist, we'll be biopsying them soon. They're not large, but they're growing, and they're meeting the size that is typically the size that you want to be concerned and take a biopsy. So then we'll know whether or not it's a hepatoma or hemangioma.
Thank you, Kay, for sharing that, because it's going on right now, and I really appreciate you being so open. Are you having any pain at this time?
Well, every now and then I'll have a pain, and it's quite honestly at the same spot that I had in my prior my prior diagnosis. So it's not constant.
Okay. All right. So Kay is going to stay here with us. We are going to bring Bill and Dani back to the stage and conquer these questions. All right. So let's bring them. Let's see. There's Dani and there's Bill. And if you are watching the replay at a later time, just know that you can jump to every single question as it's being answered, so you don't have to wait. So if there's a question that really speaks to your heart, you can jump to it. Look at this. We have 3 survivors here. This is fantastic. All right, so we have these questions, many of which were actually asked as people were registering. And again, just a reminder for people watching this now on Facebook or the replay, that Kay is a nurse, but we're still not dispensing medical advice. The 3 of them will share whatever personal experience they can. And let's start with this first one here. What do you feel are some of the best protocols or supplements to detox the liver, not only in general, but also if there has hopefully been some apoptosis? So does anyone feel comfortable answering that about any supplements you take or protocols to detox the liver? Anyone take it away?
I could talk to that if you'd like.
Sure, please.
I have to lower this window. Let's see. Technology. Actually, and I actually work with my patients that I work with today. Some want to do a detox, others don't. I personally don't choose to do a detox. I believe in eating a high antioxidant diet that reduces inflammation in the body and loss of healthy fluids in the diet. However, if my patients want to do a liver flush, liver detox, I want to preface it by saying whatever you choose to take, make sure you talk to your healthcare provider first.
Yes,
These, even if you get a capsule, the ingredients in those capsules, you have to know what are in them. And you have to know if there's they can have some serious, dangerous issues if they have a reaction to the medication you're currently on. I actually would strongly recommend, and this is one of my go-to sites that I use all the time. It's a wonderful site to reference. Is that okay if I tell them about the site?
Yeah, just give us the URL, and Michelle, if you could look that up, and we'll put it in the chat.
Okay, it's a Memorial Sloan Kettering Cancer Center, and I'll just read you. Let's see.
Well, don't read to us. That's okay. No, don't read to us.
Okay.
We'll make sure.
There's several. It's support services and treatments for adults, then integrative medicine, and then about herbs and botanics and other products.
Okay.
They have researched tons of supplements, herbs, and other products, and it's evidence-based. So I really believe this is a site that if you're going to go there, they will be able to tell you if there's any contraindication against what medication you're on. And an example, if you were going to take a flush, there is one that uses milk thistle. I'm just going to tell you it uses milk thistle. And if you were on warfarin, which is a blood thinner, one gentleman was on warfarin, and when he took it, it increased his INR from, which is a blood thinner lab test for those that you don't know. It increased it from 2.64 to 4.12. And that's very dangerous.
Right.
So that's an example of what this website does.
Okay. So Michelle, again, if you could look for that, and we will put that in the chat. Thank you so much, Kay. We're going to move on to the next one. It's a very similar question, a little different. What is the best food for liver tumors? And I do want to state before I go to Bill and Dani, if they have anything to add, that there are many studies that show that coffee is good for the liver. So for we coffee drinkers of the world, we really like that. So just putting that out there. Coffee, good for the liver. Alcohol, not so much. So Dani or Bill, would you like to speak to that? Are there any foods or things, I know, Dani, you actually work in nutrition, that are good for the liver?
I am a bit disappointed because I'm not a coffee drinker. So every time I hear that at all, but my mom was. Hopefully, you know, I still have something. My mom is. Well, so when she was pregnant with me, I think I told you, I think I OD'd on coffee before I was born. But artichokes, for me, I've always loved them. And you know, I'm not a nutritionist. I work supporting school nutrition professionals. But I read somewhere and actually asked the doctors, you know, about artichokes. And they were, you know, yes, great. So that's one for me. But I try to stay away from red meat, which is, you know, I'm not a huge fan of, so that's hard. That's not hard. I love sodas. So I try not to have them at home. Because it's my little addiction. And, you know, so in terms of, you know, of trying to keep healthy, I think, you know, what we were saying before, just a healthy diet, antioxidants, and, you know, plenty of fruits. But you know, I think I told you that before, Andrea. I live a very normal life. And every day I wake up in the morning, I thank God for that, because 20 years ago, I didn't think I was going to be here. So just the fact that I'm waking up and I'm breathing and I can eat pretty much what I want and I can do whatever I want, I never take that for granted for 1 second.
Bill, what about you? Are there any particular nutritional tips you have, or things that you do to help the liver?
Yeah, I found that eating ginger, and I buy the actual ginger root, and I put it in my tea, and I drink green tea, and I like cucumbers. I will eat occasionally some Greek yogurt. I love cinnamon, but I try to keep my carb down, my salt down, and fat out of my diet. So those things have always helped, keeping those very, very low. And I was told that very, very early on, back in the 80s, to keep salt, and I've been salt restricted and calorie restricted since the 80s.
Okay. All right. Thank you so much. All right. So we are moving on to a more treatment type question. And again, just want to preface that this is not medical advice, but all three of these amazing survivors can share any personal experience that they have had. So this question is from Braylene. How can you improve your white blood cells and CEA during IV chemo? And I know from my experience as a caregiver, the way they did that was artificially with, I used to give my sister Neupogen shots every morning to increase her white blood cells, which it did. But again, it's sort of an artificial way of doing it. What about your experience, Kay, Bill, or Dani? Anything that was done to improve your white blood cells during chemo?
Nothing to me, but patients I've worked with, I can share that.
Okay.
Not during chemo, but typically after chemo, they'll receive an injection. There's several medications out there. It's the day after, and it's not to increase the white blood cell count, but to keep it from dropping. And they also, even though there are no foods that we eat that will actually increase the white blood cell counts, protein, we need protein to build white blood cell counts. So if you make sure that, and quite frankly, if you're a cancer survivor for HCC, you have to have protein and carbohydrates anyway to be able to have energy and survive this treatment. So protein will help boost your white blood cell counts. And I strongly encourage to get a dietitian. I asked the doctors to order an oncology dietitian and a dietitian. So ask your dietitian if it's okay to get a B12 and folate, because you also need that to actually build white blood cell counts. And that'll help with white blood cell counts.
I'm always a little surprised how many patients, even when they're seen at an NCI center, don't have a dietitian or nutritionist as part of that multidisciplinary team. It always shocks me. It really, really does.
You know, I've actually been and asked to go to their first meeting with their very first meeting with their oncologist, and it's never ordered on the first meeting. And of course, I ask him to order it, and I say not one, but until they have achieved the appropriate knowledge to manage their diet, or until their weight and their health is at a state that they can maintain it without a dietitian.
Yeah.
That's critical. Nutrition in all of this is probably the hardest thing I see in manage a patient going through their journey. It's very, very difficult. And
Yeah.
it's very critical in surviving.
Absolutely. I want to share a quick story, and then Dani or Bill, if you have any tips or anything that you did to improve your white blood cell count, I'd like you to share. There was this fantastic woman years ago. Bill, you met her, Susan, at that HCC Lunch and Learn, and she had both HCC and cholangiocarcinoma, which, for those of you who don't know, is a rare type of liver cancer that happens in the bile ducts of our liver. She had both. And she was naturally a very thin person anyway, but she also had ulcerative colitis. And so eating was always a challenge. And she was really upset when her doctor stopped the chemotherapy they were doing at the time, because she had gotten so thin and she was so frail. And she was, her son, her adult son, who was her caregiver, was very frustrated with her. And I remember having like a 3-way call with them, and I was so surprised because she was being seen at a very good center, but there wasn't a dietitian or nutritionist. Nobody was talking to her about ways to keep calories on, and be able to digest things with food that actually tastes good, and just to give her strength back. And we had such a great 3-way call between the three of us, because her son thought she was being stubborn on purpose and didn't really understand that it was so uncomfortable and difficult for her to eat. And then she finally understood, if I don't eat, I will never get back on treatment. It will not happen. And so unfortunately she did pass away a few years ago, but I just want to remember Susan. Any tips, Bill or Dani, about increasing your white blood cells? Anything that was done during your treatment?
I can say something about that because, and there's something to consider in general. This is not medical advice, but something to ask your physician about, your provider, and that is, take into consideration any other chronic conditions you might have.
Yeah.
Because in my circumstance, I have diabetes in my family. And going into liver failure, or actually where my liver was getting worse, not yet in an advanced stage, it triggered liver failure can trigger some of the other conditions that one may have. And so my diabetes, which was triggered in my 40s, whereas it might not have otherwise occurred in my 60s or 70s or at all. And because of that, I was on a American Diabetes Association restricted diet early on, and taking insulin as well. So I had, because of the severity of that, and also because it was brittle, it was very difficult to manage. I was also, again, on the interferon, ribavirin, and taking Procrit and Neupogen. So I was taking all these injections.
Yeah. Just so people know, Neupogen increases white blood cells.
Yeah.
Procrit increases red blood cells.
Right. So, so navigating what to eat under those circumstances was very difficult.
Yeah.
Very, very difficult. And the dietitian assigned to me by the university was probably one of the best that we could find in the state, or a top dietitian in the country, and had written a number of books on the subject. And this was very helpful, that attention was put to that, to find what I could eat with all holistically with the conditions I had, how I could manage getting sufficient nutrition and protein, and keep stable. So that, that was a significant issue.
Okay. All right. So we have a lot more questions to go. I'm sorry, Dani, I didn't get you on that one. Perhaps the next one. Again, not giving medical advice, but all three of these fabulous people can share any experience they have. This person is asking, what can be done to help slow fluid from building up in the liver? My friend every few days needs 3 to 4 liters drained from the liver. This started after they gave her 4 bags of iron due to low blood count, and she does not take blood. So she has so this person has stage 4 breast cancer going on 5 years. After the last drug she received, oh gosh, I lost the question. Let's see, where did it go? Okay. After the last drug she received, she developed lesions in the liver. She's on hospice. She has 3 very young children. Well, Melsina, I hope I'm saying that correctly. I'm so sorry about your friend. Does anyone here have any experience with fluid building up in their liver? And if so, what was done about it?
So mine is a little bit different because I had it right after my first surgery. Remember, I had a few complications, and I had fluid building up in my liver and going to my lungs, and they would drain it, and it's a very painful process. What they did, because it had had been caused by a surgery, they actually had a big drain here, and they had a little tube and a big bottle, and I had to be put under. It was a procedure, and I had that, I can't remember, maybe a week or a little bit longer, until they were actually able to drain everything, and that in that case took care of the problem. But it was a different situation because it was something that was caused during the surgery.
Kay, I'm going to throw this one to you as well, since this person mentioned that their friend has breast cancer and has been battling it for 5 years. So, and only recently developed lesions on the liver. Did you experience any fluid in your liver that needed to be drained? And if so, how was that handled?
I didn't.
Have you worked with any patients?
I have. The condition that they're referring to is called ascites.
Right.
And it's actually not in the liver. It's actually in the abdomen, and more specifically between the peritoneal linings. And and also I'm very, very sorry to hear about her friend and what she's going through. And we have limited information about her friend, but it sounds to me like the information that we have here, that she's in liver failure, and without being able to look at the total clinical picture, it's hard to ascertain how it was triggered. But I do want to reassure, is it Melsina?
I think it's Melsina.
Melsina. Melsina and her friend, that the 4 bags of iron, because she did not want blood, I really believe had absolutely nothing to do to trigger the ascites.
Right. So
I want you to know that's really important for you to understand. That was not the causative reason for that. And also, I think you need to understand that the physicians, before they started doing this draining of the fluid, they really looked at the risks and benefits of even starting to drain this fluid, ascites. And Bill, I think you mentioned that you probably had this too, this buildup of fluid in your abdomen. Yeah. As it builds up, it's very uncomfortable, very, very uncomfortable. So they wanted to weigh the risk and benefits of doing this procedure, which is a paracentesis that removes the fluid from the abdomen. And they felt the comfort it would provide her would outweigh any risk that was there. And so if they didn't drain it, it would continue to build up and it would press up against her lungs and possibly go into the chest. And so I think that overall, this was the best solution to provide your friend so that she's more comfortable. And in the end, unfortunately, like me, she had breast cancer, so she's not able to have a transplant. I could not have a transplant. And I have worked with several of my patients that were in hospice. I have to tell you, they are one of the most amazing organizations. They will work collaboratively with the family and treat your friend with the utmost dignity and respect, and make sure that she is as comfortable as possible. And I can't say enough about hospice. And I'll be praying for your friend. Thank you.
Thank you so much, Kay. I want to ask all three of you a question, and I want to let our new questioner, Rafi Dancer, love the name, Rafia Dancer, stand by. We are going to bring you to the stage if we can, so you can ask your question. It's a really good one. So just hold on and stand by. I see that you're live with us on the back side here. I can see this stuff. But this is what for all three of you. And we'll start with you, Dani. Something I feel like most people don't realize is that, even when you survive cancer, there's lifelong ongoing care, whether you're treating long-term side effects, but more specifically, what kind of ongoing follow-up do you have to do today? Let's start with Dani, and then we'll go to Bill and Kay.
Yeah, so for me, I have annual checkups and scans with my doctor, and everything that I want to do, I have to run, by them. So so I have two kids. I think I told you, 12 and 8. And of course, I had a hard time conceiving. So we did go through IVF. Wow. And that was a very interesting process because, you have to wait for the right time, and no physician will tell you that will be risk-free. So you have to understand. So I was in between, like, physicians in Brazil and physicians here, and liver doctors and cancer doctors, and, my IVF doctor here, but everything was okay. I had a very healthy pregnancy, but it's an added layer of complexity to everything. Even if when I hear these stories, I realize that I got off very, very easily once I went through, my journey. But the lifelong, impacts in my life are not that significant. But having that, so the first thing, like, that I think about anything is like, oh, is it cancer? Can I go somewhere? Oh, they prescribed me this medicine. I'll call my physician right away to make sure it's okay. I know some of the things that I would tell a new doctor, but, taking charge of your life and your health. So being armed with the knowledge when you meet a new physician, because, like, it's been 20 years now, right? So, and I'm sure Bill can attest to that too. Like, you see a new healthcare professional, they look at your files, they're like, oh my God. And you're just like, I can't explain, that's okay. And then we walk through it.
And do you have ongoing scans as well? I just want to kind of help people understand.
Yeah, so I do. So every year I do, my lungs, I do that. I now have x-rays, but I do the MRI or the CT because we alternate, and I do the blood work. Just in case. That's ongoing. I go and, I go to see them, and immediately I make my appointment for next year. And it's always, because when you have a recurrence, you always carry the PTSD with you. So I feel like every time I go and get my tests, my blood work and my scans, and I see the doctors, like, Judgment Day, am I granted another year, or this is it for me? So, it does get a little bit easier, but everybody around me knows that week is very difficult for me. And then now you get the results on my chart, and it's always like, oh my God, take a deep breath. So it stays with you forever.
Yeah. Bill, what about you? What sort of ongoing surveillance, to use the medical term, do you have to do?
So I have a team. I have an endocrinologist, I have a hepatologist, I have a liver transplant surgeon, and so forth. So, and a nephrologist. So I have stage 3 kidney disease and chronic kidney disease. So I see a nephrologist every 6 months. I see my endocrinologist every 3 months. I see my transplant surgeon every year, and my hepatologist.
Wow.
every 6 months. So
Wow.
you know, this
ongoing.
is ongoing. I've had to have cataracts removed due to all the different medications I was on that
Wow.
caused problems with my eyes. I've had to have very intense management with regard to diabetes, but I'm
Yeah.
now been able to half the amount of insulin and so forth. I've had other issues and hospitalizations that have occurred fairly mild compared to what I had
Right.
25 years ago. But I've had skin cancer removed since then. So, you know, life goes on. There's other physical things we have to look at our bodies and take care of it. And otherwise, I feel like I'm in great health, and have kept up with all my vaccinations and so forth. So, you know, we're staying.
All right.
We continue to stay healthy. It's an ongoing activity. You know,
Okay.
taking care of our machine.
All
Yeah.
right. So I'm going to ask everyone to stay with us for 10 more minutes. I hope our panelists can stay. I'm going to have Kay answer that question, and then we're going to bring, we're going to try. We've never done this before. I mean, I know it's doable, but we're going to try bringing this person to the stage so they can ask their question. Kay, what kind of ongoing follow-up do you do today?
For HCC now, I am having MRIs every 3 months, lab work, and of course, we're going to be doing the biopsy. And I want to point out, it's interesting, time has changed. My original biopsy was done through a laparoscopy, and now it's going to be either ultrasound guided biopsy or a CT guided biopsy. We haven't decided yet. Yeah, it's interesting. So I'm an old surgical nurse, so I really want them to see the liver, but they're not going to be able to see the liver this time. So it's a little strange. But anyhow, also I've seen endocrinologists because once I went on Arimidex, it did severe damage to the bone. So I have, bone osteoporosis, and so I see an endocrinologist for that. By the way, I'm on Maui. I have to go to Oahu for this. We don't have endocrinologists on Maui. Specialists. Wow. I have to fly to Oahu to get health care. So I also have to go to Oahu to see the liver specialist and get that done. And I also have a nephrologist because I went into kidney failure so many times during treatment that my kidneys are also not functioning to the fullest extent. And I'm typically hospitalized at least twice a year because of my blood pressure issues. And I'm on dopamine drips, usually in the ICU. And my lab work, I take labs probably at least once a month because of, primarily because of my kidneys. And I have that done about once a month. Wow. But, I build it into my calendar. It's, I don't let it affect my daily life because it's just part of moving forward with my own day. And I don't dwell on it. If I did, then I couldn't move forward and enjoy life. That's what I'm here to. I'm alive. And that's what I'm going to do. I'm going to enjoy my life.
Oh, you guys are amazing. Okay, so Rafia Dancer does not want to come to the stage. I'm sorry if I put you on the spot. I don't know who you are, but I'm sorry if I did. But you do have a great question. We'll do our best to answer it. And I would just ask you to keep in mind, even though Kay is now dealing with some new tumors and they're not quite sure what they are, all of their experiences happened in the past, and some in the very, distant past. So this next question, I'm not sure our panelists can answer, but we will try. So I'm surprised that no one's talking about or getting immunotherapy for the liver. I am considering it. What do you know about this? And so again, I'm just going to say that immunotherapy, it did not even exist for liver cancer when Bill had it, when Kay had it, when Dani had it. So I'm not sure, but have any of you had any sort of immunotherapy?
I have not, okay. But in the case of fibro, I think we talked about this, Andrea. There are a number of patients, they are being treated with immunotherapy, and a lot of them are seeing a lot of success. So that fills all of us with hope, because when I got sick, was either you get the surgery or else. I mean, there was nothing else to be done.
Right.
And even the protocols are changing. Everything is still very experimental. But in my case, a lot of physicians are now saying, even though the second time around, they had plenty of margins and, you know, I was fine. If that happened today, they would probably put me on a regimen for 2 years. Just to make sure that there was no recurrence, because in the case of fibro, most of the times, I mean, almost all the time, it's and that's the other thing I didn't talk about fibro. The recurrence, the rate of recurrence is very, very high. So it wasn't expected. I mean, it was, for me, but now it's, you know, a large percent of the patients. So even if you don't see metastatic activity, chances are they are microscopic. So just to be on the conservative side, a lot of the patients are doing that. It's called triple therapy, and it's all immunotherapy right now with a lot of success for a lot of them.
Okay, quick yes or no, Bill or Kay, did you ever have to do immunotherapy?
Immunotherapy was not around when I had my there wasn't much available when I was around. There was transplant, surgery, laser therapy, cryotherapy, and that pretty much was about it as much. And they had some off-label use of drugs that they were considering, some drugs that were being used for the colon, and then they decided not to use. And but I do know that immunotherapy is being used today for HCC, and I also believe they're doing a combination of chemo and immunotherapy in some cases. And I think it's going to depend on case by case on what type of cancer you have, the size, the location. You know, it's going to be case by case specific, and it's important that that you make sure that you're part of that care team, that you understand what's happening with you, and understand what their plan is for you and why they're developing that plan for you. I think that's really critical in today's world.
Okay, so this last question we have before we have to say goodbye to everyone, I'm just gonna, I see LA is the name of the person. I put my email in the chat. Please email me, because your question is about finding a doctor who can help you with liver issues in Nashville. We can definitely help you with that. So please, if you could email us, and we will get that answered for you. Also, Kay mentioned earlier about Memorial Sloan Kettering having that integrative medicine with herbs. That link is in the chat. And just a quick recap here, please do the polls. You do have to click on the word poll. I don't like that, so it doesn't open up automatically. I thank you so much for doing the poll about your relationship to HCC. If you could also do the poll about how much your knowledge about HCC has increased or improved, we would really, really appreciate that. We are a little bit over time, so thank you so much for staying with us. Real quick, Michelle, if there are any questions in the Facebook live stream, could you throw them in the comments throw them in the questions real quick. We'll stay on for one more minute, because last time we had a question come in right at the end from Facebook and did not know about it. But please, if you could, in the chat, if you could give an applause for these 3 amazing survivors, Kay Anderson, Bill Remak, and Dani Duran. Thank you so, so much for sharing your stories today. And Michelle, can you let me know if we have any questions? Just a quick yes or no in the chat. Any questions from Facebook? I also want to remind people there's a green button at the bottom. Thank you, Michelle. There's a green button at the bottom. Please join Blue Fairy's liver cancer community. It's a private community. It is not a Facebook group. Please don't talk about your healthcare in Facebook groups, or at least be wary and know that it's not private. But our liver cancer community is private. It's HIPAA compliant. It's available in English, Spanish, and Portuguese. So please join that community, especially Rafia Dancer. You had questions about immunotherapy. That is a very hot topic in the community, and a lot of people discuss it. Again, thank you so much, everyone. We really appreciate your time, and I am so honored to know all 3 of these panelists. I hope you have a wonderful, wonderful rest of your day, wonderful Saturday, and take care. We're going to end this broadcast. Bye, everyone.
Bye.
Bye.
Thank you so much, Andrea. Thanks, everybody.
Aloha.
Bye. Bye.